The COVID-19 pandemic brought to the fore challenges that women are still facing in accessing maternal care. The cost of prenatal and postnatal care, distance to facilities, and poorly paid community health workers have all made pregnancy a burden that weighs heavily on women from low-income households. Mashirima Kapombe tells us more.
Jane Mudhoni, fondly known as Mama Jane, is a community health volunteer in Kawangware, Dagoretti North. She got into this line of work when a close friend of hers died of HIV complications. Her duties include making visits to 100 households to disseminate information on good health practices. Those with pregnant women and children under 5 residing there are a priority. On this day, her patient is 20-year-old Naomi Mashango, who is 3 months pregnant. This is her 4th pregnancy. The previous 3 ended in a miscarriage.
Nimevumilia tu tishandiwana ni keep strong. Anatufunza skills. Nikiwa kama ninahisi siko sawa, wanampigia simu nakaa kwake.
Kuna ile hali huwa mtu anasikia ni kama ako worthless kwa community. Kitu ya kwanza anaangaliwa na community yake traditionally. Inasemekana either yeye amerogwa ama yeye pia kuna vitu amefanya ama ametoa mimba nyingi mpaka sasa hawezi hold mtoto.
Mama Jane doubles up as a counselor when the need arises. In this case, Naomi requires moral support because her journey to motherhood has been long, tedious, and painful. She carries the burden of a previous pregnancy which terminated at 6 months.
Nilianza tu tena kubleed, hiyo sasa ikuja hata na pain. Kubleed tu, na bleed tu. Toka kama kwa live na wakasema huyo bado nini zake ziko nini haezi wekwa kwa incubator. Akapass tu hivyo.
Naomi is hopeful she will carry this pregnancy to full term. But she has just discovered that she has an incompetent cervix, a condition that can be managed.
Kwa hiyo nini mtoto akiwa mkubwa yenyewe inajifungua. So anasema sijui wanatumia sijui stitches gani ni scientific name, I don't know.
Having the procedure though costs more than she and her husband can afford.
Aliniambia but hakuwa sure 7,000 to 12,000.
Naomi is enrolled for Linda Mama. In a perfect world, she should be guaranteed free access to services. But the free services did not include the operation she needed to strengthen her cervix and prevent another miscarriage. Receipts from the Mbagathi County Hospital show the lengths she will have to go to hold her baby.
Because I need this baby, itabidi ni sacrifice hata kama ni kukopa.
At the NHIF services, it is not explicit. It is just a standard. We treat, we will actually facilitate 1 to 3.
Sophia Anindo is another one of Jane's patients. She has enrolled on the Linda Mama program and was glad that her expenses were reduced.
Kila mtu alikuwa ananunua pampa, besheni na sabuni.
Ideally, when you say that there's no use of fees, means that you should just get in, give birth, and go home.
Unlike Naomi, she experienced no complications with her pregnancy or childbirth. However, the distance from Kawangware to Mbagathi County Hospital, where both women are receiving care, is a headache.
Niruta hakuna maternity. Ijafunguliwa bado.
Niki-consider pia fare kwenda. Alafu nikifika mahali tena nikishukia DOD tena nitembe naona nafika mahali nachoka hiyo kizunguzungu ya ukiwa na mimi.
Gatina Dispensary and Riruta Health Center are the closest public health facilities for residents of Kawangware. However, women in Kawangware have to travel at least 10 kilometers to Mbagathi County Hospital to deliver, or a little further to Kenyatta National Hospital in case of an emergency. It's even worse when they need an ambulance.
Nakumbuka kuna mama moja alinipigia simu saa 5 na saa hiyo sasa kafyu imeanza, lakini kuna namba tulikuwa tumepewa in case of anything unapiga simu, unaelezea mahali huko, unakuja kuchukuliwa. Hiyo mimba ilikuwa inamsumbua, ameanza kumbleed. So unaona kuanzia hiyo saa 5 mpaka saa 11 huyo mama alikuwa tu ameteseka mpaka akili yake. Amepiga simu, anaambiwa tunakuja. Pia walikuja, walimwambia atalipa hiyo gari na ni ambulance. Na nile yenye tuliambiwa itakuwa inasaidia wa mama. So walichukuliwa hata wakalipa hizo pesa, lakini it was too late. Wakati ule alifikishwa Kenyatta, alienda akapoteza hiyo mimba.
Really, that's really wicked. And our constitution says, like to Article 43, that every Kenyan should have access to free, affordable, and accessible healthcare. You see, that's in the constitution. And so we should make arrangements at the county level, especially with reference to maternal and child care, that area of the constitution is really implemented, because it is a point of starting life. We cannot afford really to play games with this kind of thing.
Jane looks forward to the day that healthcare facilities near her will cater to all maternal needs, a dream that Kawangware residents pray will soon become a reality. This Riruta Health Center has a maternity wing that was constructed recently, but its doors are locked.
It is actually not operating. Reasons and a mess, so the county government actually understand.
Me, the politician, to be seen cutting a ribbon and saying I built a facility. We are very good in hardware. But when it comes to software, to ensuring that we have the right staff, the right number, the right competencies and skill set in those facilities.
Maternity wing in Riruta Satellite is something that we also look forward to, and we are working every single day to ensure that we can clear some of those pending issues.
Delivery costs in the country varies depending on location and hospital. Public facilities remain cheaper for normal and CS delivery. As long as the women are enrolled on Linda Mama or NHIF, they should pay nothing from antenatal, delivery to postnatal care. But why did Naomi have to pay for a pregnancy complication?
We found out it was very worrying, because you find an in charge of a facility that is not very well updated with the package that NHIF offers. So 2 things happen. Number 1 is that they do not claim that service. So then the hospital loses the reimbursements. But number 2 also is that they are likely then to either deny that service or to put a cost to that service to the patient.
In July this year, President Uhuru Kenyatta commissioned 5 out of 24 health facilities that were set up to improve access to health care for Nairobi residents living in low-income settlements. But primary health that starts with a CHV like Mama Jane requires greater investment.
I really don't like the word volunteers, because it depicts somebody who works freely. And really, you can't expect somebody to be rendering you work, taking their time to work for the county without being remunerated.
In Kisumu County, community health workers earn a stipend and are covered under the NHIF program. In Nairobi County, a Community Health Services Act that will guarantee the same is yet to be implemented.
It's taken quite a bit of time following those government protocols, and that is very important in terms of accountability, as I mentioned. So this process is still ongoing.
So if they're not facilitated, I'm looking at it, they're actually investing their economic hours to provide unpaid care services. But if they're not facilitated, they're not equipped, they're not even protected, then we're going to lose a generation that at my age we will not have the next group of CHV coming on.
Steps that all stakeholders agree will be instrumental in raising the standards of maternal care across the country and achieving 0 deaths. Mashirima Kapombe, Citizen TV.